Welcome everyone to an APH Virtual Excel Academy. We are so glad to have you with us today. Today is basic first aid for the visually impaired. Love to have our friends join us today. Again, welcome to an APH Virtual Excel Academy. We're going to stretch our knowledge with first aid. We hope you get in, get comfortable, and maybe you have some Band-Aids with you. That was one of those items to talk about. Excuse me. Again, welcome to an APH Virtual Excel Academy. Feel free to say hi in the chat. We love when our friends come and join us. Today is basic first aid for the visually impaired. Welcome, Donnie. Glad to have you with us today. Hello, Nikki. I see you there too. I would love to turn it over to Melissa Hodgen. Melissa is a nurse. Hi, Melissa. How are you?
I'm great. Thank you for having me.
I'm going to let you share your screen.
All right.
We are so lucky to have a nurse with us today.
Okay. Well, thank you for having me. This is such a great subject. And let's see, make sure that we are all on the same page. Okay, great. Okay, so let's go back. So my name is Melissa and I am a nurse. And one of the reasons I am so excited that you have joined us today is because not only is this a subject that you will be able to use to potentially help yourself, but to help those around you, and you can use it forever. So our goals for today are object number 1, to know the importance of giving first aid, and object number 2, to react correctly to a given emergency situation. So I guess the first question is, why is this even something that we should give our time to? And if we do give our time, then why is it something that once we know, we should act on? So first is, knowledge is power. One of the hardest things is to watch someone that you love suffer and not be able to do anything about it. And I think on that same level, it's hard to watch someone suffer knowing you could have known something that would have helped them. So that is why we are here today. And I think you're going to love it. Also, you don't need anything other than what you have with you right now to help someone. You have all your senses to use. You can feel for someone's chest rising up and down to know if they're breathing. You can smell to see if you smell a fire or blood or various things. You can hear if someone is gasping for breath. So it's not like you need some expensive intervention to be of good. And then the other thing is, the worst thing that we can do is nothing. There is always something that can be done to make someone's outcome amazing. Okay, oh, sorry. Okay, so my first question, and I would love for you to think about this and give me a response in the chat box with a Y for yes and an N for no, is, have you ever heard of a Good Samaritan? And there's a reason I'm asking this. So if you could put in the chat box Y for yes, if you have heard of a Good Samaritan, and N for no, if you have not heard of a Good Samaritan. So it looks like Johnny has not heard of a Good Samaritan. Let's see if we have some other answers coming in. Monica says no. So we're going to learn this soon. I just want to wait and see if anybody else has. No. Okay, well, this is going to be great because it doesn't look like a lot of you have heard of what a Good Samaritan is. Okay, so I'm going to tell you what a Good Samaritan is. A Good Samaritan dates back, okay, let's see. let me see here if I can help something real fast. So as I fix this, a Good Samaritan dates back from the Bible, actually. And it is a parable where Jesus, he told a story about a man who was on a road to Samaria, and he found someone who had been robbed and beaten, and he helped him, and the man lived. And so a Good Samaritan is someone who acts on behalf of someone else in need. Now, there in this country is let's see, okay, real fast. I am going to see how I can make Robin a co-host.
Don't worry. That
You
was a
don't need to
message
worry
for
about
Jeff.
that, Miss Melissa. Keep on going on.
About that, thank you. Okay, let's go back to, okay, so if we now know what a Good Samaritan is, why do you think we would have something in our country called the Good Samaritan Law? I'm going to give you some options. This is a question with multiple answers, or sorry, with one answer, but I'm going to give you a multiple choice option. So now knowing what a Good Samaritan is, what do you think then a Good Samaritan law in our country means? And I'm going to look for you guys in the chat box. Sorry, is it A, you will be paid for your services? B, you cannot be sued? C, you will be arrested if you rob a victim. So if you could start in the chat box. Again, A, you will be paid for your services. B, you cannot be sued. Or C, you will be arrested if you rob a victim. I'm going to tell you once we get some answers in why I actually chose some of these multiple choice options. Okay. So let's see. So we have Tina says B, you cannot be sued. Donnie says A, you will be paid for your services. And Nikki says C, you will be arrested if you rob a victim. So the answer actually is, oh, and Billy says A and Anthony says A. You know, wouldn't that be lovely if all our good deeds were rewarded with financial compensation? That would be awesome. The actual answer is B, you cannot be sued. And one of the reasons this law came about was because someone went to help someone, and in the process they stepped on their pinky and broke their pinky, and the victim sued the provider, the helper, the Good Samaritan. And after that, there was a fear of helping those in need because of being sued. And so thus this law came about, which is the Good Samaritan Law. And it says it protects any volunteer giving aid to an injured person in an emergency situation. Protection in the form of exemption from liability, acting as a safeguard to those who help in a real emergency, life or death situation. Now, I'm a nurse right now and I'm wearing my red scrubs. And so that would kind of see an obvious reason for me to intervene. But the joy is that anyone in any situation can be a provider. And that's what I'm going to talk about next. What is a provider? Because in our scenarios from here on out, we're going to be mentioning two people. We're going to mention the provider and the victim. So what is the provider? Think of your parents. Your parents provide you with home and food and transportation. They provide you with things that you need. So a provider in this instance is going to be you. You are the provider. You are providing something for someone that they cannot provide for themselves. And that is pretty special. The person you're going to be helping is the victim, a person who is harmed, injured as a result of a crime, an accident, or any other event or action. So you are going to be the provider. and the person you're helping is the victim. So I'm going to give you a scenario, and I would like you in the chat box to tell me who is the victim in this scenario, okay? So you see a dog bite your brother. Who is the victim? Now, we'll put Y for you, D for dog, or B for brother. You see a dog bite your brother. Who is the victim? Y, you, D, the dog, or B, your brother? All right, Donnie says the dog is the victim, and Nikki says her brother is the victim. Billy and Anthony both say brother. Tina says brother too. Now, as much as we might think our brother deserved to be bit by a dog sometimes, because we all know how our brothers act, it is your brother is the victim. And no matter your opinion on how he acted, you should step in and help. So let's get to some of our goals as the provider to your brother in this instance, and we'll talk about our goals. So our goal is to preserve life. First and foremost, we want this person to survive this incident. Number 2, minimize suffering. I think so many times we think of minimizing suffering as providing comfort immediately, right? Giving them a warm blanket, giving them a Band-Aid, to heal the wound. But as you also provide these interventions, you will minimize the suffering that they have psychologically, because I think we all have been in an event that has been scary to us. And long after our wound has healed, we still have a fear of maybe getting hurt again or going to a certain place. So just as you act quickly, you're going to minimize their long-term suffering. And that is also a gift that you can give. Prevent more damage. We don't want them to have further hurt. Let's think of a drowning victim. By pulling them out of the water, you are going to prevent further drowning. And last is start recovery. Now, Nikki says, what if my friend Emma gets hurt? And you know what? We are going to go over some ways, if your friend gets hurt, exactly what you can do. So let's move on to that. Thank you, Nikki. I want to start by asking you a question. I have a picture up here. It is of a box with a handle, and it has a big red cross on it, or T, similar if you're familiar with the Swiss Army knife symbol. So it's a white box with a red T or a red cross and a handle. So if you have seen these out in public, can you write in the chat box what you think this box is? So again, it's a box with a handle and a red cross on the box. It might look like a suitcase to some. Okay, Monica thinks it has to do with first aid, and Mike says he thinks there's Band-Aids in it.
You know what? We have a hand up. So we are going to go over to Tina. I am going to give you permission. Oh, you have permission to speak. Go ahead, Tina, and unmute.
I think it's a first aid kit.
Thank you, Tina. Tina is right. Tina is exactly right. It is a first aid kit. And also Billy and Donnie also said that. Thank you, Tina. I appreciate that. And I bet Tina knows it's a first aid kit because she has seen it out and about, not only in her community, but maybe even in her house. So Tina and everyone, what might you find in a first aid kit? Just think about it. Somebody had mentioned Band-Aids. If you want to type in the chat box anything else that you think might be in a first aid kit, or maybe something that you've seen, or maybe something you think should be in a first aid kit. Let me know. Oh, somebody said first aid. Oh, Nikki said first aid cream. Yes, that's exactly right. Genius idea. And I'm going to show you one shortly. Tina said cotton swabs. Yes, we definitely need some kind of absorption, because that's what cotton does, right? It sucks everything in. So yes, cotton swabs. Great idea, Tina. Yes, and Anthony agrees with Tina on the cotton swabs. And Billy says alcohol. So alcohol, and I know Billy's not referring to the kind that people drink. This is called rubbing alcohol, and he is correct. That is a cleaning agent, right? And it can clean wounds. So thank you, Billy. Okay, all right, so I am going to go to this list that I now have of some of the things that were mentioned, but also we might want to include. Now, the first thing that I wanted to tell you, oh, and Nikki says antiseptic. Yes, that is similar to antiseptics can be a betadine or a hydrogen peroxide or an alcohol. And thankfully, there's so many options that you don't feel like you only can use one. There's so many options out there. So thank you, Nikki. One thing of importance is when you are in a situation where you feel like you have to act quickly, it's always good to already know ahead of time where to go to find these. So in your home, I would suggest leaving your first aid kit in the same place. And I would check it every year to see if A, some of the materials have been used and you need to refill it, or B, if they have expired. Because some of them do go out of date and you wanna make sure that you don't wanna be looking for an alternative in that moment. So same place in your house and check it every year, please. All right, Band-Aids. Somebody had mentioned Band-Aids and I did ask you to bring some Band-Aids, and here's one of the reasons why. I'm gonna show you real fast. The Band-Aids come in all different sizes. And Band-Aid is just the brand name, but we generally tend to refer to it as any kind of sticky adhesive with a gauze pad. The joy about Band-Aids is they have one side of them. If you feel them, it's frayed, and that's so that it's easy to separate, okay? So this one side is gonna be frayed, and then all you have to do is peel it apart and the Band-Aid will come out. Now on the Band-Aid, there's one side that's kind of rubbery and textured, and on the other side, it's smooth and you can feel some flaps. And the nice thing is you can pull the flaps apart without ever touching that middle gauze pad, because that's what you want to keep clean. And the two sticky sides are going to stick to your skin. And so that is the joy of being able to keep it clean when you're putting it on a wound. And we'll talk a little bit more about that later. I also have a non-stick pad. This one says to just rip it open and rip it out. A non-stick pad doesn't have any fibers. It's gonna be very smooth, and that was good for burns, because when burns start to heal, it's going to form a big scab and it will take that fibrous material and incorporate it in the scab. And then when you go to take the bandage off, it'll rip the scab off. So that's why we use non-stick pads for burns. And let's see, Nikki mentioned first aid cream. Now this one, see if you can see, this is just, Neosporin is the brand name for this cream. It can come in a cream, it could come in an ointment, but really what it is, it's an antibiotic cream. They tend to be a triple antibiotic cream. So if you see anything that says antibiotic cream, grab it. A little goes a long way. So just a little dab will do you, and it spreads out really easily. And it is wonderful because it keeps things moist so that they can heal faster. It kills the surface microbes that will cause an infection. You know, when you see wounds that are oozing and red and sore looking, and it also prevents further scarring. So it's just a great thing to have in there. Okay, gloves. The gloves are two purposes. Number one, You don't want to catch something from someone else. There are bloodborne pathogens like hepatitis that if you have some cut on your hand and you care for a cut, your bloods will mix and you could potentially get infected. We want to keep you safe. Also, it protects the other person. Should you have, dirt on your hands or something, it's always best to wash your hands before you care for someone, but sometimes that's not possible. Hand sanitizer, we know those are in abundance right now, so you should be able to hopefully find some. It really is best to wash your hands because hand sanitizer cannot dissolve dirt or anything. So when possible, please wash your hands. If not, grab that hand sanitizer and of course a mask. Again, something in abundance right now just to protect you from if the victim is coughing, especially in a COVID environment that we have right now. Okay, so I have a question. Please type Y for yes and N for no. Do you think people keep first aid kits in cars? We've talked about them being in our homes and at our schools maybe, but what about our cars? So do you think people keep first aid kits in cars? Y for yes and for no. Okay, Nikki says yes. Okay, Donnie has an interesting question. How much hand sanitizer do I put on my hand? While other people are answering Y for yes and for no, I will answer this. About a dime size will do you. It's kind of like soap. At some point, it's not going to kill. You can keep lathering it on. It's not going to kill anymore. So I would suggest about a dime size for your hands, if that's what you're cleaning. And when you are doing antibacterial on your hands, don't forget the outside of your hands, because when we're touching people to take temperatures, a lot of times we're using the back of our hands and such. Okay, so it looks like everyone knows that you can keep a first aid kit in your car, and that is correct. We call those more personal first aid kits. Here is the one that I keep in my car. So it's really small and compact. I keep it in the driver's side door so that if I ever come upon a need, I can just reach down and grab it. And truth be told, we're in our cars probably more than we are at our house sometimes. So that's why it's important to keep it in your car. If you don't have one, you can get one at Walmart or CVS or Amazon, and they are as little as $5. Or you can make your own. Get a sandwich bag and fill it with bandaids and your cotton swabs and some of the antibiotic cream. That can all fit in a sandwich bag, and you can keep it in your backpack. They are so light and they're portable. Now, there will be some in the community, and I think once you know what you're looking for, you'll see them everywhere. Your orientation instructor has a first aid kit. Your school has a first aid kit. Your bus, your coaches, there are first aid kits everywhere, which is good because we are very active when we're outside, right? Probably more likely to get hurt outside. Provider action. Now as the provider, you have two actions: to alert or call, and to care. So I have a picture here of someone doing a yoga pose at a sunset, and it's very serene because the first part of our assessment is to stay calm. I want you to think about a baby who falls and hits their arm or something. The first thing they do is look at their mom, right? And if their mom is going, "Oh no," and her face is scared and her eyes are wide, then the baby thinks, "Oh, this is something bad." But if the mom is smiling and saying, "It's okay, come here," then the baby thinks, "Oh, I'm gonna be okay," right? You have the power to set the tone for this procedure. I knew of an ER doctor once that whenever he would call codes, he did it in a whisper, because then everyone had to also whisper to continue on in the care, and it helped everyone to feel calm. So that's the first thing you can do, is just stay calm, and you might need to take a couple breaths. That's okay. The first part of our assessment is D for danger. If you see glass, fire, gas, and you can remove it, great. But if not, you yourself need to not enter that scene. For instance, an electrical live wire. You don't want to become a victim by going to help someone else and thus get injured yourself and create more victims, right? So if it is dangerous, do not enter the scene. R is for response. We're going to talk to the person and we're going to ask them, are you okay? We're going to ask them in both ears because my son has a hearing impairment and he is more deaf on one ear than the other. And so for him, I would need to say both ears so that I could make sure that he was actually hearing me. If you get no response, tap him on the shoulder and ask him again, are you okay? There was someone once who saw their neighbor face down on the ground, and they went over to pull him off and start CPR, and they realized they were just turning on a faucet. So we want to make sure that we know what we're doing. Are they actually in need of our help? And last one is airway. Okay, if they're on their back, put your cheek or the back of your hand, because I know we're concerned with COVID about inhaling. You can put the back of your hand near their mouth and feel for that warm breath. You can watch the chest rise and fall, or you can put your other hand on the chest and feel for the ribs rising and falling to note the breath. And you can understand how the breathing is. Is it fast? And is it very shallow? Is it not moving very deep? Or is it slow and very deep? Those are all things that will give you more information about what's going on. And the last thing is, I'm going to show you a picture of a head tilt chin lift. If the person is on their back, oftentimes their tongue can fall over their airway and thus prevent airflow, okay? And all you have to do is take your hand, put it on the forehead, and push down towards the ground. That will automatically raise the chin up and open the airway. So again, the picture is of a man. He is on his back. This is the victim. The provider is kneeling next to them and has one hand. We tend to use our dominant hand, so mine would be my right, to push the forehead down and back. And then they have their left hand under the neck, lifting it up, and that will open the airway for that person. And you can check for breathing again. Okay, the last one is R, recovery. We want to position them on their side because if they vomit, or they may have a potential of getting the vomit back down, it may come up and then go back down into their lungs. And that vomit is very acidic and it will burn the lungs and it will cause pneumonia and all sorts of problems. So we want to rotate them. I have a picture of someone. He is rotated on his side. His top leg is bent over for support. And the arms are, one of them is under his chin, because that'll help keep the mouth open because they'll kind of push on the jaw. And just the most important part of the recovery position is just get them on their side so that they will keep their airway and they will not aspirate. Okay, so if there is one or more person available, then you point to them and say, you go call 911 and come back and help me. So now, what did I just say was the number that you call in an emergency? Oh, and I will answer. So I will repeat my question. What is the number you call in an emergency? And Donnie has asked me, what does aspirate mean? Aspirate means to any foreign object in the lungs. So let's think about when you've been swimming and you inhale some water, right? Your body is going to cough that water out. Your lungs cannot handle any foreign objects because it interferes with the oxygen exchange, right? So if a person is unconscious, they may not have the capability to to know that they are even vomiting. And so they would throw up and it would just come back into their lungs. And if their airway is already compromised, then it's going to enter the lungs. So aspirate, and we'll talk about this later in choking, aspirate is a foreign object in the lungs. And that includes water even. Okay, so so let's see, Donnie says 911 and Tina says B. And let's see, okay, so the correct answer for what do you call in an emergency? Oh, and Tina also says 911. It is correct, 911. This number is different in different countries, but for the United States, it is 911. This is a number you call when someone needs help. Oh, and thank you, Nikki. Yes, you're right. I'm so glad to hear that so many people know the number, because I've often thought, in an emergency situation, will I be able to remember this, and will I be calm enough to push 911 send? But knowing is the first step to prevention, right? So 911 is what you call when someone needs help right away. Immediate danger is happening. So we know that losing your cell phone is probably not an immediate emergency, or your brother eating your dessert. So do you have any ideas of what might be a reason to call 911? So if you would like to enter that in the chat box, what ideas have you even potentially already seen of when you did call 911, or you knew someone who called 911? What are some scenarios that might? Yes, now Nikki said, if my friend Emma is choking, yes. And we are going to talk about why, even if they choke and it comes out, it's still important to get her seen. Anthony says, if your house is on fire, yes, please call 911. And the joy about 911 is the 911 operator will answer. And that operator has connections to police, fire, and medical services, which I couldn't remember all those numbers. So I'm so grateful that in this point, this dispatcher has been trained and has access to all of that. So she will do the work for you. Now, here's the key. We're going to talk about this in a second, but when you call, the first thing you said, oh, Billy said if someone is bleeding really bad. Yes, blood carries oxygen, and that is what keeps us alive. So Billy, that is exactly right. Thank you. So the first thing you need to do, okay, can you use 911 with Siri? That is a great question. I don't know. I would try it for sure first. And if anybody knows that answer, please pop in. I would try it first. And if it doesn't work, then you can always call. But yeah, if somebody knows, I would love to know that too. Great question, Nikki. I love that. Tina says a baby is born. Oh, yes. And that mother will be very grateful. So please, great idea, Tina. I love that. Okay, one of the keys. Oh, Siri will call 911. Thank you, Jeff. See, you don't even have to be able to see the phone to call 911. I love technology, and that is, I can't wait to see what else comes out in the future. Thank you, Jeff. Thanks, bro. So the key here is once you're done, resist the urge to hang up. That operator is going to stay on the phone, and she is going to continue to give you advice on what to be doing with this person. And she's going to continue to collect information that she can send to the ambulance or to the fire department. So stay on the phone. So even if you feel like you can't see well enough to physically care for the person, you can be the lifeline on the phone giving those directions. So everyone is important here. And Donnie said when people have seizures, yes, that is very important. My son had a seizure, and that is exactly what we did. So here's what you need to be able to tell the 911 person. I want to emphasize to speak clearly, slowly, and calmly, right? She needs to be able to understand the communication we're trying to give her, right? And she will do her best also to help you maintain that. So first, tell them that you are blind. That will help them to No, okay. Here's how we can best tell this person to care for this person. And they will be able to guide you more easily and readily and functionally. So first, tell them that you are blind. Second, address and location. I am at this street address in this school. Here's a landmark. It's across from the post office. I'm on the 3rd floor in room 222, the cooking lab. The more details you can get, the faster they will be able to find you. 3, what is the emergency? Are we dealing with a seizure? Do we have someone choking? Is someone unresponsive? That will help them to know who to send, as well as they can prepare on the way so that they will have things ready for that person. And last, who needs help? Is it a group of people? How many victims are they preparing for? And is it young? Is it old? Is it, are they in a water area? Like, who are these victims? And I think one thing that we often forget is we think somebody else will know what to do, right? There's an adult there. But what if the adult is actually the one who is injured? So that's another reason why it's important to kind of start learning these things right now before we can't just assume that somebody else is going to be there to take care of it. And the other thing is, what if you're by yourself? Okay, so we're going to start with a scenario here. You are eating dinner with your family every night, right? We eat all the time, lots of opportunities. And your dad tells a great joke and everyone is laughing, but your brother suddenly stops and he starts turning red. What do you do? If you want to enter in the chat box what you think might be going on or what you might do, please feel free. So again, you are eating dinner with your family and your dad tells a great joke, which happens all the time at my house. And everyone is laughing, but your brother suddenly stops laughing. What do you do? Okay, Tina says the CPR method, and we will talk about that. And that is a part of it. But anybody else have any ideas of what you think is going on or what you might do if you see your brother stop laughing and start? Anthony says, give 911 a ring. All right, we're gonna get to these soon. I'm excited. You guys are giving great answers. Call 911. Nikki says, call 911. Monica asks what to do if we can't see them turning red. Okay, let's move forward, Monica. That is a great question. Okay, so I'm gonna skip past this real fast. The first thing you can do, Monica, is ask, are you choking? So let's talk to them. Because the thing is, you do propose a good question. If you can't see them turning red, and what if you can't hear them? That's a good question, but you can always tap them. And my guess is somebody in trouble is going to get your attention too. So the first thing is, are you choking? And here's the thing, if they are coughing, you want to continue to encourage them to cough, because if that cough can get out, that means air is moving past whatever is stuck in their throat. So they are still able to move air. If we start pounding on their back already, it might lodge it further into the trachea, and then it's going to cause bigger problems. Monica says that it sounds like they will make an unusual sound or a big cough. So yeah, encourage them. Say, you're doing great. Keep going. Cough harder, cough harder. We're here for you. Just help them, because that force of air is actually going to push the piece of food up and out. So you want to encourage them to cough. Now, if they're not coughing and they do this sign, I have a picture of someone. It's a male, and he has both his hands wrapped around his throat. He's leaning slightly forward and his mouth is open. This is what we call the universal sign. This is worldwide for choking. If they are panicking clutching their throat, their face is starting to turn red, or their lips are turning blue. This is the universal sign for choking. So Nikki says, what if Emma has food stuck in her throat? So first we're gonna ask her and see if is she choking? She's probably gonna nod. If she's coughing, we're gonna encourage her to cough. Now, if she's not coughing, here's what we're gonna do. You will put your arm across the front of the victim's shoulders and have them lean forward, okay? That's gonna help gravity and provide support as well. Okay, so we're gonna have them lean forward. We're gonna take the palm of our hands, which is the flat part of our hands, not our fingers, but the flat part under. We're gonna take the palm of our hand. We're gonna go in between the shoulder blades. So the shoulder blades are on the back. You can feel along your back is your spine. It's that bony kind of snake-like thing along the back. And on the upper part of your back, you'll feel two flat bones. So we're gonna go in between those two flat bones, kind of along the spine, right there. We're gonna deliver a firm blow, we call them blows, to the back between the shoulder blades along the spinal cord, okay? So we're gonna give one back blow and then we're gonna check. We're gonna hear, can we hear her coughing now? Is she starting to move some air? Did that actually come out? You know, is she talking now? If not, we're gonna deliver another one. We're gonna do that 5 times. Blow, check, back blow, check, back blow, check. If this victim is still choking, if that has not helped, we are gonna move to abdominal thrust, or what is called the Heimlich maneuver. You might have heard of that before. Now I'm gonna describe this to you. So abdominal thrust are meant to move an object blocking the throat by placing a fist on the stomach, because, right, all of those, the trachea, it's all going down near the abdomen, near the ribs, right? So we're gonna place a fist on the stomach and forcefully thrust inward and upward to dislodge the object. So here's some easy ways to figure out your placement. If the person is bigger than you, okay, you're gonna take 2 fingers, you're gonna run it up along your rib cage until you feel the place where you have a breastbone, where your 2 ribs meet. There's actually a little bone there called the xiphoid process. It feels like a trampoline or a diving board. It's pretty flexible and it's very small, okay? So you're gonna go up to that, and that you're gonna place your fist, you're gonna make a fist, and you're gonna place thumb side into the stomach area, right below that xiphoid process. You're gonna take your other hand and wrap it around. Here, I'll stand up so I can show you. You're gonna take your fist, make a fist, into the area below your ribs. Other arm is gonna wrap around that hand, and you're gonna deliver upward and inward blows in that manner. And I gotta be honest, it's gonna take more effort than you would think it would. So you're gonna fear hurting them, but give it all you can, because it usually takes a lot of energy and a lot of effort to deliver an effective abdominal thrust. Now, if the person is smaller than you, all you have to do is just kind of find halfway between the belly button and the ribs, halfway between the belly button and the ribs. That will get you in the right place. So again, you're gonna take your fist, you're gonna put your thumb into the stomach area, the abdomen. You're gonna wrap your hand around that fist and deliver up and in abdominal thrust. And what you're gonna do is you're gonna give one abdominal thrust, check the airway, just like we did with the back blows. One abdominal thrust, check the airway. You're gonna do that 5 times. Now, if after 5 times we've done the 5 back blows, 5 checks, 5 abdominal thrusts, 5 checks, then we call 911. And at this point, even if you can move the object out, they still need to be checked out by 911, because there has been so much trauma to the throat that the throat may swell and it may close, to which they would have to do something called a tracheostomy, which would be to put a hole in the throat. So it's a very serious condition. So you may think, oh, they're fine. Still call 911 and get them checked out, because you don't know how long it will be until that swelling potentially starts. Now, if we're waiting for the emergency to come and the person collapses and becomes unconscious, then you want to start CPR. So they need to be unconscious before starting CPR. They won't let you do CPR if they are conscious. So don't worry about, are they conscious? Are they not? Should I start? If you start CPR on somebody who is still conscious, they will let you know to stop. So don't worry about that. Okay, let's go into another scenario. You're home alone and you trip and scrape your knee. Okay, so again, you're alone by yourself. You fall down, you scrape your knee. Okay, here's what we're going to do. We are going to find the cleanest cloth possible and apply pressure. So here is a time that I want you to answer in the chat box. Y for yes and for no. Do you know where in your homes you have some rags or bandages? So Y for yes and for no. Do you know where you might find a rag or a bandage in your home? So Donnie says yes. Great. I'm so glad. Nikki says yes. Tiffany says no. Anthony says yes, and Billy says yes. So here is your homework. If you don't know where you have some rags or bandages in your home, ask your mom or go find, so that you can know ahead of time. Because remember, an ounce of prevention is going to make that moment so much less intense for you. So that is your homework for tonight. Now, notice in here I said apply pressure. What is pressure? Would anybody like in the chat box to say what they think pressure is? When I say apply pressure, you've cut yourself, you scraped your knee, you're bleeding. Sorry, I don't know if I was clear about that. You are bleeding. You have your clean rag now. You need to apply pressure. What does that mean? Ooh, Tiffany said press down. Yes. It means to press down. Hard or soft movement. Yeah, pressure can be hard and firm, or it can be gentle. That is true. Thank you, Donnie. Donnie said that. Donnie said hard or soft movement. And that, I think that is so insightful, because it's true. We need to monitor and see what is going on to see how much pressure we need. And Billy says, squeeze tightly. You guys are ahead of the game. I'm so impressed. You know your stuff. What is pressure? So pressure, we have blood vessels, and I brought a straw to kind of show you. This is just a little rubber straw, and our blood vessels are like straws. And just as a straw, have you ever had a straw when it got pinched and nothing could get through and you're kind of bummed? Our blood vessels, when we apply that pressure, it pinches them and it stops the bleeding, and it gives those blood vessels time for the clotting factors to start coming and stop the bleeding. So it helps our body by giving it time. So wow, you guys are ready for nursing school. Okay, so bleeding, we need to apply direct pressure to the wound. So we're not going to go around the wound, we're going to go directly on the wound. We're going to lay the person down. Since we're alone today, we're going to lay down, right? We're going to lay down on the floor. We're going to elevate whatever part of us is bleeding. If it's our arm, we're going to raise our arm. And when I say elevate, that means lift it up above the heart. The heart is what is pumping blood, right? So the heart, if we can get it above the heart, gravity is going to help us. And it is going to pull that blood away from that that injury, and it's going to help those clotting factors to stop the bleeding. So elevate that. Now, if you fear you broke something, let's not move it at all. Let's just leave it on the ground because we don't want to further injure. Remember how we talked about prevent further injury as the provider? Here's one of those instances where elevating would cause further injury. Now, if whatever cloth you're using, if it has bled through, instead of pulling that off, because remember we might have started some clotting, let's just add another cloth to the top of it, and that one will start soaking through. Now, you can use almost anything as a cloth. You don't have to find your rag specific. You could use paper towels. You could use your jacket. You could use, a lot of teenage girls will have maxi pads. Those are great for stopping bleeding. There are so many things around you that you can use to stop bleeding. How are we going to clean this wound? If we are helping, if we are the provider, we are going to try, if we have the opportunity, wash our hands and put on gloves. Sometimes that's not available. It's ideal. If possible, great. If not, we'll move on to rinsing the wound with clear, clean water to loosen any dirt and object. That'll flush it out. It'll clean it out. Because remember, we fell in our house, so we might have gotten some in there. I've had friends that have fallen and gotten rocks lodged in their knees and such. So you can just rinse it out, and sometimes that water flow will just take that debris right out. Yeah, that would hurt. Donnie asks, how long until does EMS take to come? Well, Donnie, that is something you're going to need to evaluate based on where you live and where you are. If you're in a big city, well, there might be traffic, right? I live close to the fire station, so it probably would only take them about 4 minutes to get to my house. But that is definitely something to consider as you are caring for how much time do you have to take care of this person, because you're going to want to do as much as you can before they get there. But I would take stock of how long from maybe your own house you think it would take them to reach you. Okay, so Nikki said that Emma would be thankful for a first aid, and I think that Emma would. As we continue, we're going to get Emma all fixed here with this wound. So I think sometimes we think we need to apply something, but really the water is the best thing to rinse out. And then we're going to take a soft washcloth that's wet with mild soap, and we're going to dab around the wound. If we put soap directly in the wound, it'll actually irritate it. And so we're just going to kind of clean the area around, because remember, germs are gross and they can travel. So we don't want them traveling into the wound. So we're going to clean around it. And then the last, we're going to take that small amount of antibiotic ointment and we're going to apply it to the wound, because that's going to help with the germs, with the healing, and such. Okay, I'm going to give another scenario. Let's see how much time we have. All right, this will be our last scenario. You are cooking mac and cheese. I did this yesterday. And the boiling water splashes on your hand. What do you think is going to happen to your hand with that boiling water splashing on your hand? If you want to comment in the chat box, I'll give you a moment. You are cooking mac and cheese and the boiling water splashes your hand. Nikki says you will burn your hand, and that is correct. Donnie says you should put cold water on it. Also correct. Donnie, you guys should be teaching this class. You are doing amazing. Okay, so probably what we're dealing with here with just a splash of the water is a superficial or a first-degree burn. Yes, and Billy and Anthony also said you will burn your hand. Correct. You guys are becoming wonderful assessors already. You're going to see redness, which is you might see also with a sunburn, right? You run it under cool water for at least 10 minutes. This is going to slowly bring the temperature of the burn down on your hand. Now, you can apply ice packs, which you can make out of a sandwich bag. Oh, okay. A sandwich bag filled with ice or frozen vegetables. But we don't ever want to put ice directly on our hand because we could potentially cause a freezer burn or like frostbite, because sometimes we're in so much pain, we don't necessarily notice that it also might be coming from the ice. So we're going to want to put a cloth. You can get a washcloth, you can get a paper towel, you can put your jacket in between the ice pack and your arm to prevent that potential opposite effect of the freeze from the ice. Okay, Donnie asked, what is first degree? Okay, so as we go through these, there are different degrees of burns. And first degree is superficial. It's the very top layer of skin. Your skin has many layers before it gets to your muscle. And the most top layer, which you'll notice if you have a sunburn and it peels, it's going to be just that top layer of skin. That's what a first degree burn is like a sunburn, when that top layer of skin is going to be peeled off. Okay, one other thing that I love in talking about the sunburn is this stuff. This, I'm holding up a clear bottle. It has some bluish gel-like liquid in it. This is called aloe vera with lidocaine. Lidocaine is, it numbs. So if you have a sunburn, put some aloe vera with lidocaine in it. And if you really want to feel extra cool, you can put it in the fridge and then put it on, and it'll be extra cooling. The thing that you don't want to do when you have a burn is add something with oil to it, because if you think about it, oil heats up, and what does hot oil do? It burns things, right? And it can actually burn your skin, and it seeps into your skin, and it can burn actually deeper than you would have even had. If you get burned by anything chemically, meaning you have a cleaning agent and it gets on your hands and it's starting that redness, you need to go to the hospital, because sometimes those are things that you cannot simply rinse away. If you go to, and here's the last thing I'll teach you, and then next time we will maybe continue on with the different degrees of burns and what to do. The palm of your hand equals 1% of your body. So remember how we talked about the palm of our hands with back blows? That equals 1% of your body. If you burn more than 5 palms, which is 5% of your body, you need to go to the hospital, even if it's a first degree burn. There can be a lot of fluid shifts that will cause imbalances. So remember, 1 palm of your hand for you, because that's specific to your size, or 1 palm of the victim's hand is equal to 1% of a burn on their body. So if they have more than 5 palms on their body that are burned, please go to the hospital. Now, I know this is a lot of information and it can seem very overwhelming, but I want you to remember that you have everything you need right now on you to care for someone, and that doing anything is the best thing you can do. And by learning today, you're taking this first step to helping someone in the future, because there are billions of people on this planet, and at some point they will need your help. So thank you for listening, and I hope you learned something, and I'll see you soon.
Thank you so much, Melissa. I hope we actually have you back, because I know you've got lots of great advice for us on first aid. Wonderful. And it sounds like we've got some people who really put on their thinking caps and had some great ideas that were actually the correct ideas on top of that. Now, we're done for this week. Next week on Tuesday, it is My Mouth is a Volcano. On Wednesday, we have another man camp day. And on Thursday, Dress for Success. We look forward to seeing all of you. And again, Melissa, thank you so much. And thank you to our closed captionist, Robin. I'll see you next week.
See you next week, everybody.
Bye
Bye-bye.
all.